that one decision to go on that trip to Haiti was a complete fork in the road that never in a million years would I have imagined the incredibly fulfilling things that I've been allowed to encounter because of it.
Today, I'm going to talk to you about an opportunity that can change your life. It can take your mundane, kind of routine life and add some spice to it. It can help you look at things from a totally different perspective, become more thankful for what we have, and even thankful for our healthcare system.
Really?
If you're wondering what I'm talking about and what has the power to be so transformative in people's lives, I am talking about medical missions. I'm going to be talking to a PA. His name is John Oliphant, and he has done some amazing things around the world and is helping to inspire the next generation of PAs to do the same thing. So, welcome, John, and thank you so much for being here today.
I'm so glad to be with you, Michelle. I think you and I met in an elevator in Nashville at the National PA Conference. And so it's fun to have gone from that random encounter to actually getting to hang out with you on the medicine couch today.
That's what I love about what I'm doing is you never know who you're going to meet and the interesting stuff that you're going to learn from people. Before we dive into the topic, tell us a little bit about you and kind of what your career path has been.
I could have never guessed all the different twists and turns that would come along. I've done primary care, internal medicine, emergency medicine, occupational medicine. I've been kind of morphing, which will get us into our actual topic for the day. Really been doing a deeper dive into global public health kinds of issues and have just been named the director of global public health at Rochester Institute of Technology. We're creating a new Bachelor of Science degree in global public health. We have a minor up and running. We have a really active global public health association.
I'm curious what sparked your interest in global health. Is this something that's always been an interest, or did you have some particular experience that led to it?
I'm just grinning as you ask that question because it was the furthest thing from my mind. Absolutely. I remember as a kid, there was this little church I was going to, and some people there had started going to Haiti to do like some kind of mission work. And everything about it sounded completely uncomfortable to me. All I could think about was, do you get to take showers? And like, what are you eating? And do you have air conditioning? And I don't know. I had zero interest in it at that point. But later on, I think it was after the big earthquake in Haiti in 2010, a cousin of mine, Julie Went, had started getting involved with going down to Haiti. And she kept coming back with these stories of this transformational experience that she was having. And then she started working with the organization Restore Haiti and then started leading teams down there. And all these, she kept asking me to go, but I wasn't really interested. And the teams kept coming back, though, describing these unbelievably life transforming experiences. And I think I had finally gotten into a little bit of a rut, just a little bored with the same old, same old. And she finally convinced me to go. And we finally went in early 2012. So it was almost 2 years. It was a little more than 2 years after the big earthquake, but I just couldn't believe what I saw when we landed in Port-au-Prince. The Capitol has a building that's sort of like our White House with a Capitol dome on the top of it where the president lived. And the dome was still lying in the front yard, just crashed all to pieces. There was tent cities everywhere, kids desperate for food and whatnot. And my brain was just exploding. Like I couldn't believe what I was seeing. I'd never experienced anything like it. At first, I was completely overwhelmed in a negative way, like I'm not gonna be able to do this. But then we kind of drove through these beautiful mountains down into a southern coastal city called Jacmel. And it was a little calmer down there. And we just started integrating in with the local people who were amazing. And I completely fell in love with everything about it. I just met these amazingly kind, resourceful people who had so little, but were so welcoming, were so hospitable. I had this one experience that was clearly the transforming thing for me. It was on the very first day there, I met this little boy named Colson, and he had skinned his knee. I think he was about maybe 10 or so. And I started this daily routine throughout the week that I was there where I would see him each morning. I would clean up his knee, I'd put a fresh bandage on it. But we'd also been charged with trying to learn some Haitian Creole words every day. And so I would ask him to teach me some new words, and then I would give him a Cliff Bar as payment for his tutoring services. And we just kind of kept bonding over that time. Somewhere during the trip, I remember we would drive around in what they call a tap tap. It's basically like a pickup truck with wood planks along the back bed where we would kind of sit on them like bench seats. We're driving at night under this perfect Caribbean sky with a guy playing guitar, people are singing. It was just like, I'm like, I've never felt this alive in my life as I do right at this moment. Why did I wait so long to come down here? Then the last day, they gathered our team together and were thanking us for our services and were hoping that we would come back. And little Colson showed up and he asked at the end of the host adult guy's speech if he could say something. And he just started saying, I just want to say how much I love Dr. John. That's what they called me there. They don't know what a PA is exactly. So because he helped me, I want to be able to help other people someday the way he helped me. And I just love him so much. So I made him this little tree and bird thing out of ceramics that he had painted himself. And I was like getting all kind of like unexpectedly emotional, like choked up. I didn't see that one coming. And I remember flying, I think our first flight took us into Newark, New Jersey. And that was the first time I could use my cell phone and call my wife. I hadn't learned how to do the international calling stuff yet. So I remember calling my wife and she said, so how was your trip? And I just had no idea how to summarize it in a couple sentences. And I was like, wow, it was really hard. It was really great. I said, well, I met this boy, Colson, and I start trying to tell her about him and I get all choked up again and can't even speak. And she's like, are you still there? I'm like, oh, yeah, I think we got a bad connection. I'm trying to pull myself together. And anyway, so I was like, clearly something has changed in my brain and I couldn't imagine not going back to see Colson regularly. And I guess the thing that hit me super hard was I had absolutely no say in where I was plopped down on planet Earth and into which situation I was born into, that I can just show up at any hospital and they have to take care of me. We had encountered a guy having grand mal seizures in the middle of a city street, banging his head over and over again on some cement blocks. And so our team went over, one of our nurses kind of like cradled him until the seizure stopped. And he didn't wake up, but he had a pulse and was breathing. And we realized there's no 911 to call. There was no ambulances to get, but we could get a taxi. And we got to the hospital and told them what was going on. And they said, who's paying for all this? And we said, we don't even know who he is. Like, I don't know. And they said, well, unless you're agreeing to pay for all of his care, then just take him out of here because you can't get care without upfront payment. Like when I go take my dog to the vet or something, it's so all those things, the connection with Colson, just that seizure guy, and just seeing all these beautiful little kids that had so much potential, but if certain things didn't go well for them, they might never even live to adulthood. So all of that made me kind of move my focus from just individual patient care to more public health and like big picture access to care, inequities, all the different social determinants of health and that kind of stuff.
You sometimes don't really understand what we have here in the United States. Even as flawed as our healthcare system is, we are still incredibly fortunate. And so I love that you shared how it changes your whole mindset.
Some people get mad at people that are focused on global issues instead of domestic issues. And it's not an either or, it's a both and. Our world is so interconnected now. People and pathogens are zigzagging all around our world. So I just think we all need to have a global view on health, whether we leave our little community or not, because most likely people are coming to us no matter where we go.
The term missions, it doesn't necessarily denote that it's religious in any way or that it's tied with a religious organization. I mean, it may be, but is the term medical missions kind of used as an umbrella nowadays to mean any kind of organization?
Medical missions sometimes could be through a faith-based organization, but many times it's just a humanitarian, I want to help people kind of organizations. People come to their desire to help other people in a lot of different ways. Sometimes it's a part of their faith. Sometimes it's just at their core, like I just want to be a helpful person. So yeah, I think that's a good point to clarify. Medical mission does not imply only a religious situation.
Do we have to have a supervising physician when you go overseas, or are you working under the different laws of that country? How does that work?
When I first started trying to figure this out, I was given a lot of bad advice. I talked to well-meaning people who had been sometimes on 20 medical missions, and they would say things like, they're so desperate there, they don't care about any of this legal stuff. If you know how to do stuff, just go do it. And they would try and bring expired medications down there. One little funny side story about bringing things into the country was this one group told me they kept getting frustrated that they would get all these medications, they'd bring them, and then the people at the customs at the airport would see them and confiscate them and take them away. And they couldn't understand why that was happening. They started realizing that the people at customs were always men, and that they were very squeamish around women's underwear and bras and panties or whatever. And so they started shopping for those kinds of garments, and they would wrap all their medications in bras and panties and smuggle them into the country. And I'm like, wow, like what is going on?
Right.
So, and when I eventually became the director of medical and dental operations for that organization, Restore Haiti, and a board member. So as part of my PhD dissertation, I focused all on trying to figure out the answer to your question and related things with bringing things into the country and whatnot. And so I went and I interviewed all these people from the Ministry of Health in Haiti, and also did interviews with lots of other people who had hosted medical teams and healthcare workers from that country. What I found was that the local Ministry of Health thought we were breaking the law constantly, like we were doing things completely illegal constantly and unethical constantly. And I'd asked, like, you guys don't have physician assistants in this country, so what do you think when a guy like me comes? Like, is that allowed? And they said, we understand what PAs are, we understand what you're capable of, so that's totally fine that you come down here, but these are the guidelines that we wish you would follow. One is that you need to have a local host healthcare provider or healthcare organization that is overseeing your arrival, that they work with you in advance to figure out what the goals and objectives of your mission are, that they help you figure out what the follow-up plan will be, that all of your healthcare providers, whether it be physicians, PAs, NPs, or RNs, LPNs, all of you need to submit your licenses to the Ministry of Health. And then we would grant you temporary privileges to do what you're trying to do in our country. And again, we'll do that for PAs as well, even though we don't technically have a PA profession. We understand what you're capable of. We would prefer you would buy your medications locally. We actually have a pharmaceutical industry, and it's way cheaper than it is in the United States, but it is a way that our people make a living. But they said, if you have access to medications that are not locally available, don't smuggle them into the country. Tell us what you have access to. If it's something we think we could actually use, we will give you a letter that you hand to the people at customs that says, we have permission from the Ministry of Health to bring this item. I'm like, wow, what a revelation,
It's much better than being a smuggler.
Right. The Victoria's Secret smuggler or something. And they pointed out too, somebody from our country just showed up in your country and started seeing patients without getting locally credentialed, we'd get arrested, right? And so you should get credentialed when you come to our country. If somebody's just started trying to smuggle medication into the United States, they'd get arrested. Well, that's why we take it from you. We're not arresting you, but it's not legal. So just kind of register your mission with us. We have a whole epidemiological world here as well. So if you are seeing patients that have mumps or measles, which I've seen both, the first time I went there, I was embarrassed because all these little kids kept having swollen parotid glands, and I couldn't figure out what is going on. I've never seen anybody with bilateral parotid gland swelling. And then I'm like, oh, wait, I remember, yeah, this is mumps. Like all these kids have mumps, and realized that many of them don't get a measles, mumps, and rubella vaccine, whatever. So I said, if you have a team there, we want you to record all that stuff, hand in a summary of the kinds of cases you saw. So if there is any outbreaks or something, we can know about it. It just became totally freeing to me to feel like what I was doing was completely integrated into their healthcare system, that I wasn't sneaking around. They knew I was there. I had local partners. If there was an issue with something that needed ongoing care, we had a group of people that could continue. And so we ended up really shifting from a model of we're just there to see patients and then leave to
Right.
much more, how can our team offer some value that is different than what your local people have? So a few things we did. One is I was able to bring the chief of infectious disease from a local hospital with me, and we had a microscope donated. And so we brought it to the little clinic that we work at that just had nurses, no microscopes or anything. But he spent a week training them how to use the microscope, teaching them how to do thin and thick blood smears so they could evaluate for malaria. So left them with a skill set that they didn't have and a tool they didn't have before that could carry on long after. Another time, our group taught teachers first aid classes. So then they could kind of train the trainers kind of model. So then they could keep teaching their kids first aid classes in an ongoing fashion. Another time they said, we think we have lots of diabetes and hypertension in our country. So what our team did is we would come down, we would, whenever like an outside group comes in, it sort of is an exotic event for the local people. There's all these strange people from afar. So we can draw a crowd. So we got the whole community together. We started talking about signs and symptoms of diabetes for one session, another one, signs and symptoms of hypertension. But then we handed it off to the local nurse who was well known in her community. And it was sort of like a power sharing moment or something, like you gave us your attention. Now we value this nurse so much. Please pay attention to her, and she can tell you what she's noticing. And then where our team became useful was the PAs and doctors and nurses set up stations where we would do like finger stick glucose testing. And if somebody was found to have high blood sugar, we first sent them to a side station where a Haitian doctor was, and he would prescribe something for them. Then they would move to another station where a Haitian nurse was who would set up their follow-up plan. And then we trained some younger folks who had an interest in healthcare to be community health workers who could then go out and visit people and check their sugars for them if they couldn't come to the clinic. So there was a whole, like, we got it started, but it was, they took over, it was their doctor, their nurse, whatever. Same thing with the blood pressure, onto the Haitian doctor, onto the Haitian nurse. You don't need us for that. And then made sure that they knew that this was an ongoing thing, most likely. And there was locally available medication that was very cheap. And we were also taught very clearly, do not bring us expired medications. If it's expired and it's not appropriate for you, why do you, like, are we second class? Like, no. So that was another valuable lesson.
Yeah, as you were talking, I kept thinking the term respect just kept popping into my head. When you think about it, it's really kind of a superiority, like we are coming to
Yeah.
help you and save you, and we are going to do what we think needs to be done, no matter what your healthcare system and your government says, right?
And there's so many stories like that of people that are, I'm sure, completely well intentioned. They never in a million years want to hurt somebody, but I've alluded a few times, I think, to this idea of like a Ziploc bag full of pills, like donated pills. And there's a book I highly recommend for your viewers that might be interested in this called When Healthcare Hurts. I think it was in that book that there was a mom who brought in two kids, I think like a teenager and maybe an infant or a small toddler, and she didn't speak English. Visiting team didn't speak her language. They didn't have a great interpretation system set up. And they gave her two Ziploc bags full of pills with directions for each. One was for the older kid, one was for the younger kid, directions written in English. There was no great plan to make sure she understood what she was supposed to do. And she got confused and gave the big kid pills to the little kid, and the little kid died. Just all the things that can happen when you patient leaves without having a clear understanding.
So, if somebody is interested in doing this, how do they know, or how would you suggest that they check out the organization they want to work with?
I mean, it definitely takes a little bit of homework. If it seems like they're recruiting you more to have some adventure or something, you're volunteering, there's obviously some good work that might be happening, but it's also marketed somewhat as like a vacation or a chance to see something. And be careful of those kind of situations. If you don't see that there's a pretty significant orientation process before you go, then that screams all kinds of potential red flags to me. again, you want to really understand the place you're going. I would just really double check who is our host organization or who are the host providers. Are we going to be submitting our credentials to their version of a Ministry of Health? If not, then that's not a good sign. Will we be going through a pretty nice training period to get ready for what we're going to be doing? Who is going to be managing anything that we identify after we leave? That kind of thing. I think too, just I'm kind of heartbroken right now when I watch the news about what's going on in Haiti. I
Mm.
think I've been there 6 or 7 times and have lots of people I really care about, but right now it's just completely not safe to go to Haiti. So investigating, is this part of the world that is okay? We don't need you getting abducted and held for ransom, or all those kinds of things. And I think if what they're doing seems like it's completely different than what you might do in the United States, that's a big red flag. They should be talking to you about what's appropriate to wear. This is another lesson that I learned the hard way. I initially was told, they don't care what you wear. It's really hot there. Just wear like shorts and a t-shirt. Like, the clinic doesn't have air conditioning, so they don't care. They know you're Americans and whatever. When I talk to the Ministry of Health people, they say, do you go to your hospital wearing shorts and a t-shirt? I said, I put my head down in shame and said, no. And they said, why do you think it's appropriate to dress like you're at the beach when you're seeing patients or something? And I said, I don't know. That's what I was told. And they said, well, you weren't told by a local person that. So any organization you're going with should have probably some kind of a uniform that they, talk about wearing. The other thing they said is your organization should make sure you have an appropriate ID badge that you're wearing, and it needs to identify who you are and what your role is in the language of the local people. And there's terrible stories of medical students thinking like, well, this is a chance to really test my wings and do some surgeries that they're not officially trained to do yet. And because, who cares? They're not going to sue me. Or stories of people doing personal exams, breast exams, pelvic exams with other people around, or sitting in
Yeah.
a group of people asking personal medical questions. So if your group doesn't basically seem to be following the equivalent of HIPAA, whether they have that exact law, that's a red
Yeah.
flag. So just thinking, what do we do in America? And for the most part, we should be doing roughly the same thing there, with lots of integration with local people.
I'm still not clear then about the whole supervising physician question. So, are you saying it really depends on what the laws are of the country that you are going to and what they require?
I think that's probably a good generalization. I know the three countries that I've done this kind of work in are Haiti, as we've discussed a lot, the Dominican Republic, and Liberia. And in Liberia, I was actually able to get licensed as a physician assistant there. So they do have a PA profession. They have the Liberian National Physician Assistant Association. They basically asked me to submit my NCCPA and New York State credentials. They asked to see my transcripts, and they basically gave me a license to practice medicine in Liberia. So I think most of the time the organization will help you navigate that. If it's a good organization, they will understand the country that they're taking you to, and they will understand what the local laws are. Like in Haiti, what they consider is I'm working under the supervision of that local host doctor that's basically supervising our whole team, not just the
Right.
PAs, but they're supervising the doctors too. One of the most famous organizations, Doctors Without Borders, is not PA friendly at all. They don't recruit PAs to go on their trips. NPs can, I think a lot of times they might fall back into an RN type role in many situations. Sometimes they might be able to practice more to the extent of their training.
How much experience do you really have to have before you go do these?
I think there's a role for any level. It's going to be super important that you understand your level of training and expertise, that you don't practice beyond your scope of practice, that you stay within yourself and don't try and be a hero. I've had students go with me before, and they were kind of taking a history, doing a physical, kind of presenting it to a supervising doctor or PA, just like they would be if they were on clinical rotations or something. They would never be allowed to see somebody completely by themselves or put together a whole diagnosis and treatment
Right.
plan. So I think all of us who have gotten at least past the first year of PA school have something to offer, but obviously the higher level of skill, the more applicable. I've found the people with the backgrounds that I think have really thrived are either primary care people, emergency medicine people, or sometimes like OBGYN and pediatrics have a pretty, good niche. Maybe one way of answering your question too is just making sure the team that you're considering is going to be doing the kinds of things that you at least have some kind of background in.
I guess naively, I had thought, oh, well, I'm going to be volunteering my time, then at least most things will be paid for. Maybe I'd have to pay for my airfare, but that's not what I've seen in some of the organizations. You have to pay like $1,500 to be able to go. Plus, you have to arrange your airfare. Is that kind of common? And if so, can you explain that a little bit more?
Yeah, I think that is that is fairly common. So it takes a special breed of person who's willing to probably give up a week or two of vacation time because it's not a vacation. You're going to be tired. I think most groups do try and build in, like maybe a day at the end of the whole experience where you do go do something fun, or in the evenings you might unwind and check out local scenery or whatever. But it is hard work. So there is giving up some time that you could have gone off on a relaxing vacation. And then I think all of these things are basically run through nonprofit groups for the most part that don't have some huge budget to hire people to go on these trips. So it is something that people have to generate. The way most people do it, though, is through some kind of fundraising platform. If you sign up to go on one of these trips, oftentimes what people will do is put together some sort of a letter that describes what it is they're going to be doing, where they're going, why they're going, what kinds of stuff they'll be doing there, and say, I need to raise some money to be able to do this and would appreciate your support. People will have like fundraising pages set up to generate the revenue they need. And lots of coworkers are like, man, I don't want to go, but I think what you're doing is great. And I'm happy to pitch in $50 or whatever it is to help get you there. I know one nurse that went with me to Haiti. The nursing association at our hospital had a fund that she was able to apply and got a grant. I'd say a lot of times it's like a $2,000 thing to go, depending on where you're going, the airfare at the time. Most of the places keep the expenses pretty low in country, like you're probably not staying at an all-inclusive resort, you're probably staying in simple accommodations, and meals aren't going to be crazy expensive. And they do recognize if they make your existence completely miserable, you will never come back. You will tell
Right.
people how horrible it is. And so they try, I think, make it somewhat enjoyable as well as fulfilling.
If people are watching this and they are interested in getting involved, if you're a PA and want to go do this, do you have any suggestions on where they go to find these organizations?
Yeah, I mean, besides just the classic Google search to see what's out there, I think the organization Physician Assistants for Global Health would be a good starting point. Again, I think Haiti's kind of out of the mix right now. And as I mentioned earlier, that was the place where more people went than anywhere else. But there's many other parts of the world that are low resource that could stand to have some external support and partnership. That I think that group would probably be the one for PAs that I would recommend the most. Again, I think the key would be just thinking about the things we talked about earlier, about if you come across somebody in a Google search, are they doing all of the things that make it seem like they've got it figured out about integration into the local system and being respectful of the local system and all that? And, then you can kind of explore it from there.
Anything else that you want to say to somebody who works in medicine who is considering doing a global medical mission?
I would highly encourage you to do it. There's actually been some really good research about people that have kind of started to feel burned out. And I think coming out of the pandemic, many of us are burned out. It was really rough that for the first time, it seemed like a large percentage of patients had an antagonistic relationship with their providers and thought we were all trying to implant microchips in them so Bill Gates could follow them around or something, and all these strange conspiracies. And you just kind of lose hope that humanity is okay. We all went into this because we care about people, that we want to help people and whatnot. So I think going on a trip like this resets your brain and your soul on some level, that there are still really good people in the world, many of whom are in very challenging situations, who actually are so grateful to have, us share our expertise. It's a chance to experience a different culture, to learn from different people. And then the friendships you make are just never ending. For me, a guy who started having no interest in this, it led me to go on and get my PhD I did it in leadership and policy and focused on how to think about leading in this kind of cross-cultural context. It led me to go on and get like a national board certification in public health. It's led for me to create global public health minor, a global public health major, an association. So that one decision to go on that trip to Haiti was a complete fork in the road that never in a million years would I have imagined the incredibly fulfilling things that I've been allowed to encounter because of it. I just feel like, a bunch of people my age are starting to retire now. And I'm thinking, geez, I just got this new program. I got to get it going. I got to see some grads. I got to see what they do with their life. I feel so far from being ready to just, I don't know, sit around and watch TV or something. Yeah. So I hope that others that decide to take that step of faith will be equally energized and find sort of a whole new calling, a whole new like mind expanding experience that opens them up. And again, even if you don't go to Haiti, like there's so many cool things that you can be doing in your local community. I've just become passionate about finding the people that are overcoming great odds to make a difference in the world. And it could be their little piece of the world. People that have started food cupboards or clothes closets for people that are needy. These agents of change that you'll encounter if you go on these kind of trips are just amazing.
Well, thank you so much, John. This has really been very not only informative for me, but also inspiring. Thank you for all that you do around the world and also for your students.
Well, thanks, Michelle. I'm so glad that I found you in that elevator. And thanks for what you're doing with this program. And, I love the mission of like, there's not just one way to be a PA. There's so many different things. That's like your kind of like entrance ticket into a certain world, but that world has so many different ways you can go. So kudos to you for what you're doing with that as well.
Thank you. I have featured a couple organizations on my channel. One is Project Cure, where they send lots of medical equipment overseas, and they also have medical mission trips. It's a great organization that works with purpose and works very closely with the communities that they serve. The other organization is the Mansoray Foundation, started by Saibatu Mansoray, who I have interviewed a couple times on this channel. She is an amazing PA who was in the Army and served in the White House medical unit, taking care of the president and vice president. Her organization has a fantastic goal of trying to reduce the maternal mortality rates in Africa. So if you'd like to know more about either of those organizations, you can check out these videos here. As always, thank you for joining me. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.